Hello, everybody. My name is Justin Novak. I'm going to be discussing about a whole COVID-19 from my personal opinion, from being an EMT for about 14 years, going on about 15. Give you a little background about my history. Um, at the age of 26, I went to kidney failure. I was on dialysis for 5 years. Um, Worked on and off for standby event companies trying to make money as an EMT because this is my career profession. Um, so I was on dialysis for 5 years, received a kidney transplant 2 years ago, and I'm on two different types. I'm on a lot of medications, by the way, but I take two immunosuppressant drugs, which means is it suppresses my immunity, and so my body won't reject a new kidney. Also, about me, I have asthma. I have a history of high blood pressure. And according to the news, I am a high risk of catching this. But me being, since I got my transplant, I work full time now as an EMT for a company. And I work 24-hour shifts. And so I'm an essential employee now. And so here's my deal about this people wearing masks, wearing gloves. Okay? I don't mind if you're going to wear a mask or you're going to wear gloves, but please do it properly. Properly. Okay? Every time I go to the grocery store, every time I go to, Walmart or whatever, I see people walk around with masks and gloves. By the way, cloth mask ain't really going to do anything for you. Yes, the CDC is saying, well, it's not going to really protect you, but it's at least something. Okay? If you're gonna, if you're really worried about it, you need proper PPE. Okay? I mean, the proper PPE would be a surgical mask or a N95 mask. Problem is, you know, CDC also said that, people need to stop stocking up on this stuff. The surgical mask and the N95 mask should be left to us. We do need this stuff because when you call us, you present the signs and symptoms of this. Well, if we're out, shit, you know, we get sick. We're on a 14-day quarantine leave, and you just lost an employee or a whole crew, basically, because I have me and my partner. That's it. And that you just downed a crew. And that is going to delay even more of having somebody respond to your emergency. Okay? So, my thing is, if you're going to wear a mask, wear it properly. Okay? Properly to wear a mask, it covers your nose and your mouth. Okay? If you're going to wear a mask, don't have it down here. Remember, stuff can still get through your nose. Okay? Or if you're going to wear a mask, don't wear it down here. There's no point of you having a mask if you're going to wear it down here. Seriously. You could have just saved those masks and donate them to your local fire department, your private EMS company that serves you. I mean, if you're going to do that, I'm properly wearing PPE. Okay, yeah, you're wearing a mask, but what is this doing? It's not protecting you. This fully protects you. Seriously. It has to cover your nose and your mouth. You don't see surgeons walking into an operating room with a mask hanging down here doing surgery. They cover everything up. Okay. Also, if you're going to wear gloves, technically, people do not need to wear gloves. Proper hand washing will help. Seriously. Proper hand washing. Okay. When I'm seeing people putting on gloves, get out of the car, they already got the gloves on, they already got their mask on. Fine. Actually, fresh air actually is better for you. Seriously, you don't need to wear a mask if you're driving, if you're outside, unless you have really bad allergies. Then that makes sense because shoot, you're sneezing, you're coughing, it's allergy season. Welcome to spring. Especially here in Texas, we get a lot of cedar. So if you need to wear a mask because of the whole cedar pollen, okay, I get it. You need to wear it. Okay. But for instance, if I'm out shopping and I walk into Walmart, a lot of Walmarts don't have the whole sanitizer wipes, the Clorox wipes or whatever to wipe down the cart or anything. So you already got your gloves on. You touch that cart that has not been sanitized. Okay. Now these gloves are considered contaminated already. So when you're walking in and you're going over and you're picking up, I don't know, this object is already contaminated. Now grab a cup that's contaminated as well. Then if you want to pick up your phone, excuse me, with the same gloves, by the way, and you're talking on the phone, hello, you're touching, boom, 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 gloves are contaminated, boom, 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 it's on the surface. Put it up to your ear, hello, it's on your face. It's contaminating. It's going to spread. Okay? Contamination. Spread. Alright? Also, please throw away your gloves properly. My opinion is, don't wear gloves. Seriously, if you can't properly throw them away, don't wear them. Okay? That, are you going to wear gloves? Okay, fine. Put the card on, grab one object, then I have to take off the glove, just like that. 2 fingers underneath, pull it up, just like that. Stick it in your pocket, stick it in your trash bag, and grab new pairs of gloves. Even though, it's funny, you touch that thing, you're going to touch an object. Seriously, it's a waste of gloves. Those gloves can go to us. We can use medical gloves. Me, with my medical history background, every time I go to Walmart or grocery shopping, and if you see me around, I'm not wearing a mask, I am not wearing a glove. Even though I am considered a high risk. I am 33 right now. Forgot how old I am. Once you turn 30, you lose track of how old you are. I'm 33. I turned 34 this summer. I mean, if you're young, you're healthy, more likely you're not going to get this. If you're old, 65 and above, pre-existing medical conditions, heart failure, high blood pressure, diabetes, whatever, then yes, wouldn't hurt to protect yourself. Carry a little bottle of hand sanitizer around if you're not wearing gloves. In my opinion, this 6 feet distancing thing, it really doesn't work, in my opinion. Because if I'm walking somebody, I'm doing 6 feet, and wearing a cloth mask, you sneeze, that stuff is going to get through. You have to have proper air filters above you. HEPA filters is what they call them. And to actually filter out the contaminated area. And a lot of times when you're going to walk through, you're eventually going to walk through and that stuff is still up in the air. It's invisible. You cannot see it. You walk through it, you're still going to breathe it in. No matter what. Seriously. I have asthma, high blood pressure, immunosuppressants. Knock on wood. I haven't been sick. So, which y'all's excuse? Seriously. Plus, what I also have an issue with the CDC is when I was in EMT school back in 2005, went through paramedic school, You know, we have N95 mask. N95 masks, you know, they capture 95% of whatever particles in the air. So it's not 100%. There's still stuff able to get through. But we will wear that if we're going into a possible TB, say like a tuberculosis patient house or something, known TB patient. Well, we will gown up, disposable gowns, N95 mask, gloves, goggles, everything. Everything's done up. Then, um, with that, we go in, treat the patient, we come out, we're still saying, it's me and my partner. Well, whoever's in the back is going to stay in his PPE, but whoever's driving, we take it all off. The reason why is I don't want to cross contaminate the driver cab where the back is. Like, if we can keep the contamination in the back, then less deconning we would have to do of an ambulance, and that takes a while. Seriously, you're taking the truck out of service for a good 30 minutes for proper decon, and so why are I see people driving around with, in their cars with a mask on. Why? I mean, you're in your car. Seriously, for God's sake. We don't drive with our gloves on. You don't see an EMT or paramedic driving an ambulance with their gloves on because you don't know. Because we know if we touch something with blood, shoot, that those gloves are contaminated. Those goes off right away. Then we have to switch gloves. Plus, it sucks having to switch gloves because your hands are all sweaty from the gloves. So we switch gloves. We switch gloves. We don't. We're not gonna cross contaminate the steering wheel. Then we gotta decon that. It's a whole mess. The front cab is our little sanctuary. That's where a lot of times we sit. We, if we're out posting, we're resting and stuff like that. That's where we are. Oh well. So, my opinion with the N95 mask, back to the TB patient, we were told once it's exposed to whatever contaminant particle, we have to discard it because it's no longer in use. Then the CD saying, "Oh well, since we're on shortage, it'll be good for the 12 hours after you first use it." Okay, and after 12 hours, boom, you gotta discard it. Now they're saying, "Oh well, you can use it forever now, because as long as you properly air dry it out." Well, all the way up since this whole entire COVID-19, we were all taught once you walk into a contaminated area with an N95 mask, that mask is no good. I get it, we're on a shortage. Problem is, we're on a shortage just because people buy this stuff up. Seriously, if you're young, you're healthy, no pre medical conditions, more than likely you're not going to get this. You know, wash your hands. Seriously, 20 seconds, wash them. In between the fingers, around here. This helps with the fingernails. Get in there, wash the fingernails, back and forth. You know, 20 seconds. Seriously. I mean, I've gone into some nasty shit. Nasty. I mean, walking out feeling like a lot dirtier than I should be. You know, but, I'm still alive. I'm still healthy. Not having to worry about getting an infection, bringing something home. Might get a little upper respiratory infection. Take a Z pack, I'm fine. You know, I've dealt with blood, I've dealt with poop, I've dealt with pee. I mean, walking into a nursing home, oh my god, some of the worst ones of all. You just walk open that door, that smell of ammonia, of urine gets to you. I mean, walking into pissy place, your shoes are all covered in piss and blood and shit, and you know, come home and I take a shower. With me, I come home, I take a shower, get my uniforms washed as soon as possible. I'm good to go. So, seriously, people, if I haven't caught it yet, by the knock of wood, thank God, with my pre medical conditions, I'm 33, I'm technically not healthy. I mean, post kidney transplant patient at this young age. I mean, if you're 70, 80, yeah, that makes sense. Me, 33, kidney transplant patient. I mean, immunosuppressant drugs, have asthma, have high blood pressure. I mean, seriously, you're young, you're healthy. Why are you wearing masks and gloves? I mean, what really ticked me off is one day I went to Walmart. I see this young couple. They got out of the car, I watched them. They had their mask on, they had their gloves on. Okay. And we were looking for some KT tape for me and in the sporting section. And of course I saw them in the sporting section. You know what they were doing? They were literally picking up basketballs and playing with them. You just contaminated the whole entire ball basket bin with your dirty gloves, and all that is going to spread. Seriously, how stupid are you? People, do not pick up your phone using gloves. Take off your glove. Sorry. Wipe it down. Later, wash your hands. I mean, my lord, get over it. While the old people wear it. Kids, you're fine. Kids are not. I mean, there's one death I heard out of a 5-year-old got this and died from it. Okay, we have kids that die all the time from flus because nobody's getting the vaccine. Got anti-vaxxers out there. Um, kids get sick, they die. It sucks. You see kids with cancer. There's a lot of kids with cancer, and they're dying. We don't have a cure for it. This is a virus. Flu is a virus. Yes, this one's a little more stronger, a little easier contacted. With me, in my opinion, is the flu is not that much contracted as this one because we have a flu vaccine. For the COVID-19, we don't have a vaccine for it yet. But what I'm seeing on the news is a lot of people are coming up with antibodies with it. So more likely, this has been around a lot longer than we actually thought. We got antibodies. That means our body already got infected with it. Probably had a mild symptom for it. Maybe a little upper respiratory infection or something like that, or fever. You go get tested for the flu. Flu came back negative. You know, got tested for pneumonia. Pneumonia check came back negative. More likely, it was probably this. I mean, who knows how long China was actually infected with this? We only got reports back in December, but China is a communist country. They have people that run the media or propaganda. So, I'm sorry. I love Chinese food. I think the Chinese history and culture, acupuncture, great. The way how the country is run, not so good. You know, I believe we need to just fully open. Let's get back to our normal selves. Summer's coming up, and listening. We're hearing, oh, this country should have a vaccine. This one, okay, but we have to have tests. That's going to be a while. People are expecting, oh, we should have a vaccine within a year. Probably not. It will take a while to get a vaccine. Wash your hands. People get infected all the time. A little cut can turn into a meningitis. So that's my spiel for today. Hope you all have a good day. My name is Justin Novak. I'm an EMT. Um, Check me out. I'm gonna try to post this on YouTube and Facebook. Thanks. Bye.